tell a story about the 150th anniversary of the first Battle of Bull Run, or as we like to call it, CW 150, which obviously stands for Civil War 150. A little bit of background information. This occurred in July of 2011. It was hundreds of events that occurred over the course of 4 days. And there was one event in particular that we were kind of concerned about. That event had 30,000 people at it. It was a reenactment. It also had 15,000 reenactors that were camping there for the entire week. And just an added bonus, it was between 100 and 106 degrees that entire week, which may be not abnormal for Atlanta, but it's abnormal for the DC area. It was also a big deal because we had 8,000 horses, no access to public water, and we had scheduled gubernatorial and presidential visits during that time. A horse, by the way, drinks 20 gallons of water a day. The Chempack, for those of you that aren't familiar with it, is nerve agent antidotes, and it's part of the SNS. It's pre-staged within your community. My community already had 3 of them. They're used to combat sarin gas, BX gas, pretty much all your nerve agents, but they have to be administered within 15 minutes in order to be most effective. So that 15 minutes is important. Keep that in mind as I continue. We felt like we needed it for this event because we had an incident with, or not an incident, but an event with historical significance, large number of people, media coverage, and the presidential gubernatorial visits. So in short, it was a highly desirable terrorist target. Now the Chempacks that we had were 8 miles and 28 miles away from the site that we would need it. Now that 8 miles takes about 30 minutes to travel on a normal day. Thank you, Washington, D.C. area traffic. We had 2 at the hospital on the east end. One was a hospital pack and the other was an EMS pack. Now the EMS pack is meant to be more rapidly deployed in the event that it's needed. So when the time came to move one, we decided that the EMS pack was the one to move. So we wanted to move it over to a standalone ER that was approximately 3 miles from the site. And that travel time was only about 5 minutes, even in the heart of rush hour. Now we knew to anticipate some challenges, one of which was this, the medication was part of the shelf life extension program. So it had to be maintained between 68 and 77 degrees. Above or below, and we risked having to destroy the whole batch of it, which was hundreds of thousands of dollars worth of materials. So we hired FedEx Custom Critical to move it for us. They provide door-to-door service, they can do the temperature monitoring, and you can schedule them to pick it up and drop it off right down to the minute that you want it done. They also background check their drivers, they provide chain of custody, they track everything with GPS so you can see where it's going from your computer at home. And they even send you a little picture of the driver before they get there so you know who you should be expecting. But it's expensive. I think it was $1,500 each way, so $3,000 total. We didn't have the money for that. We're a local health department. Fortunately, the state EP&R office offered to pay for it using some training funds that they had set aside for Chempack, if we counted it as an exercise. We also ran into unexpected challenges. Like both Chempacks at the hospital were connected to the same sensophone. If you disconnect one, the alarm goes off, and not to mention it's no longer monitoring your temperatures. Now you can't just run out to Best Buy and buy another sensophone. They're not really available that way. So we had to quickly develop a system for tracking the temperature every hour for the 4 days that we had this thing away from its sensophone. We did that with a spreadsheet and a pen, and we had the hospital security, I know, high tech, right? We had hospital security on their rounds, check the temperature, write down their initials and the temperature. But there was 2 hours each day that they couldn't do it when there was a shift change and a briefing. So they issued us proximity cards so that we could get into the hospital and do it ourselves. They gave us 3, 2 of them never worked off the bat, and the third one only got us into the room where the Chempack was stored and not through the front doors of the hospital. The outcome obviously was good. There were no incidents, but we were prepared had there been. And moving forward, we learned a lot from the incident. For example, we got a second sensophone, and we also had a long discussion with the CDC about why they shouldn't destroy our batch of Chempack goods, even though all we had to show that it stayed within its temperature range was a spreadsheet with our initials and the time and the temperature in it. We've also scheduled some upcoming exercises for this summer.